What I'm saying here is, see, aesthetics is an individual perception.
Welcome back to Journal of a Leader. There are so many dental myths on the internet.
I did have patients who asked me, root canal causes cancer. So they started adding lime, salt, you have even charcoal getting added to toothpaste.
क्या आपके टूथपेस्ट में नमक है?
They made it a brand and they left it.
So, to break all of that down, we have with us one of the best endodontists in Bangalore. He's also a former professor, he's a celebrity dentist, and also the founder of Smile Dental Care. What was your experience treating Puneeth Rajkumar?
Don't include physics or, in which you have problems sorting out with mathematics and say, get this sum right to get a seat into one of the medicals or dental.
And surprisingly, he's also a fitness enthusiast and has completed nearly 50 half marathons.
That's something which I enjoy doing it, and that same discipline has actually given me even to my profession.
We have with us Dr. Manu. Welcome to the show.
Thank you. Thanks for having me here. And
You have so many stars on your badge. Walk us through your journey.
well, my journey started about 3 decades back.
30 years.
30 years, yeah, 30 years into making. Well, like with every doctor, it's always a struggle initially. First 5 years is the time that one takes to get recognized. Then, it's a slow process, but every doctor always, when we start the profession, especially with dentists, we want to start with teaching, we want to start simultaneously with consultation, and we want to even have our own clinic. Lucky for me, I could have all the three together at the same time. And it was real running around from point A to point B and no rest. Yes, at strength 10 to do that. Well, it's taken me time to establish this. All I believe is, yes, do your diagnosis proper, be truthful, do your work. That's it. That's a long journey from there to now, whatever that I am today. Thanks.
Was dentistry your first choice?
Well, dentistry definitely was my first choice when I wanted to choose, mainly because it had its own, a charm in trying to change the entire facial outlook of any patient. So, compared to any other profession, yes, I wanted to be a dentist mainly because I'd seen few of my seniors in the same profession. So, I was definitely inspired by them as such. Yeah.
So when you got into your undergrads, did you know you wanted to do masters too? Or you figured it out and you said, okay, this is what I want to do. I want to capitalize on this.
Well, we figure out how our handwork is. Theoretically, yes, I was an average student, but practically, when I had a feel of the work, especially when you get into clinics, that is when you figure out which specialty you want to get into. So I wanted to actually get into the field of aesthetics, cosmetic dentistry, and endodontics after seeing my handwork and what I am good at.
It requires a lot of skill.
Yes, and moreover, the field of endodontics and what we call conservative dentistry or cosmetic dentistry. That's actually the main case which people come with problems due to. Yes.
What was the struggle like in the initial days after you finished your bachelor's? Did you work or did you directly go to do your master's?
Well, with me, I was lucky enough where I could directly get into a post graduation. And mine was the last batch with 2 years of post graduation, after which now it's become 3.5 years. 97 was the time where I finished my post graduation. And it was a very young age. By about 25, I was, back in Bangalore with my postgraduate degree and very ambitious. Yes, I did wanted to get and change the entire face of dentistry then, and I had the energy on with me.
You still are.
Yes, so whatever, thank God. And basically, it's all about God given gift, I should say. Yes, it's been a long journey from then on. Yes.
So after your master's, did you work under someone or did you directly open up your own setup?
Well, during my masters, I did train under my professor, and basically in dentistry, what happens? 20 to 30% of the work that we get, it's always by watching. You need hours of standing and then holding sections and watching someone work. And of course, it also your hands-on work has to be perfect to match what you see, and it comes by experience. as such. So because again, when you get into private practice, nothing can go wrong. You have to be to the accurate, the work as such. Nothing can go wrong on any patients wherever you are consulting a place or you're working on in your own clinic. It's always the reputation which matters when you start working.
Your introduction also says former professor. Can you talk to us about
Yes,
that?
first 8 years I was in teaching. I was doing.
Did you like teaching?
Yes, very much. I love teaching, and lucky that I got a breakthrough where I could get a part-time teaching work, and I enjoy doing it as such. And it also helps you keep you upgraded with your latest appraisals, whatever happens in dentistry. I did enjoy teaching, but that was only for a short while, for about 8 years.
Why didn't you want to continue teaching? Why do you not want to teach now too?
Well, what happens, see, in dentistry, the recognition among patients or your known people, when you say that you are teaching somewhere, first thing that they ask is, where's your clinic? That's the trend usually runs. So that's when I decided that I'm going to start a clinic as soon as I finish my post graduation. So that recognition always comes to you for on a large mass only if you have a clinic of your own. So that's when the work pressure got more. I thought I'll concentrate to build my brand name.
Smile Dental Care. When was this incorporated? Which year?
Well, 1997, mainly because
And how did the name come up?
yes, a colleague of mine worked in Smile Care Center in Mumbai.
Okay.
So we had a good discussion around 95, 96, around that time. So I had a dream in my mind to name my clinic as Smile Dental Care. So which happened in 97 when I started my clinic.
And even the tagline, designing smiles. It's such a catchy tagline.
No, designing Smile was I think I borrowed from some company called 3M probably, but designing smiles, yes, I think probably when you are a smile designing a dentist, you'll have to brighten the smiles all over as such. But ultimately, it's all about cosmetic work that we see, which gives a good smile to any patient.
Talking about Smile Dental Care, where did you initially start the setup? Like, where did you initially have your
Well,
first?
97, I had my clinic in Malleshwaram Circle.
Okay.
So it was almost, I can say, evening practice of 4 days and the rest 3 days. Of course, I used to work even on a Sunday, mainly because I was single.
You were
And
hustling.
y-
You were hustling.
yeah. So it started then, and I moved my clinic to Atinagar, to where I am even today as such. So I have a base of almost entire Bangalore North. See, again, what happens, one thing I've learned as such, or this is a common thing with any doctors, once people recognize you that you are honest and good in work, you get patients from
All over the world.
even, yes, I have patients even coming from other part of other
Just for
countries.
just for the treatment you provide?
Yes, mainly because one is, yes, when it comes to broad treatment, it's quite expensive abroad.
Okay.
So they choose the Bangalore path as such, yeah.
Talk about the finance part about starting up a dental practice.
Well, for anyone to start a practice, one
I've heard
thing
it's really expensive.
it is actually dental practice setting up is quite expensive as such. But again, you can definitely take loans and definitely
How
start
did you
one.
start? Did you have something saved up?
No, yes, I had something saved up because a dental chair, during those times, it used to cost around 3 to 4 lakhs. Setting up of a clinic was around 10 lakhs, base price
And
as
today?
such. Today it goes up to about 40 to 50 lakhs.
So if a BDS graduate has to start his own setup, he needs 50 lakhs.
Nearly including the place and then making up and then the interior work and then the advance and rent it up or buy a place, whatever. Depending on that, yes, it costs quite a bit.
We spoke about certain myths, right? So I want you to decode it and explain the audience whether it's actually true, whether it's harmful, whether it's hazardous, toxic, right? So the first myth is silver fillings. It has mercury, silver. Is it hazardous? Is it toxic? Because there's so much going on the internet right now.
Yeah. Now, mercury definitely is poisonous, but when mixed with alloy, you have about 2 or 3 different metals combining with powder, mixed with mercury, forming an alloy. It's definitely, it is used as silver fillings directly in the mouth as such. Now, there are countries which have banned it, but they have banned their practice only using it on patients, but they're not removed it from any text. Okay, they're not removed it from any text.
It's not
Even here, even out here, it's there in every text. Even undergraduation, you're taught about silver fillings with mercury, and even post-graduation. You remove mercury or silver filling from the text. There's nothing to teach in dentistry, to be very honest. If you ask me, a good silver filling, when it's done, never replace a good silver filling, saying that you can go for a better cosmetic filling. So cosmetic, you have tooth color fillings which have taken over and then trying to replace silver filling, saying it is aesthetically more pleasing. That is wrong to do it.
so the present amalgam fillings, should they be replaced or should they be removed?
I've seen a 35-year-old amalgam filling well maintained and without any corrosion. Never touch that. Never touch that. Never replace a old silver filling. This is my kind of
What
practice.
are few tips that you could give in order to maintain a filling for a really, really long period
A
of
good
time?
oral hygiene, a good, very good oral hygiene, and then periodic check with a dentist, maybe every 6 months. You need to check whether your old silver fillings, which are more than 10 years old, they're good enough or they need any replacement. Well, suppose even when you need to replace the silver filling, give the choice to the patient because a lot of informations are available on the net. You let the patient choose whether they want a tooth color filling or a silver filling. But if you ask me between both, for a back tooth, for a posterior tooth, a silver filling is always viable. And if any patient has one in their mouth, never replace them.
Right. And you're a root canal specialist. I'm pretty sure you've heard a lot of rumors or myths that root canal causes cancer. That is a very, very big statement. And there was also a Netflix documentary, you might have heard about it. And there's no other better person than you to explain this. So please tell me, does root canal cause cancer?
Well, it started about a couple of years back. I did have patients who asked me, whether root canal causes cancer as such. Well, the real answer is definitely no, being a root canal specialist. Now, when I got bottom of what exactly is making these patients ask me these questions, well, it was mainly the social medias actually, especially even I saw a post in Insta, which said root canal, every breast cancer patient had a root canal in their mouth. That was a very wrong statement. And I even discussed with many of my seniors who are in the same faculty as such. But I thought maybe through your podcast, I thought, let me clarify that particular myth as such. See, what is the alternative to root canal? The alternative to root canal is extraction. Now, what is the next thing after extraction? You're going to replace a tooth with what? Biosynthetic implants. That is what they're promoting. Now, that's when I came to know to the bottom of the truth that it's a false narrative created by the companies who run these biosynthetic implants. They brought about this false narrative saying root canal causes cancer.
So,
Well,
which is not true.
definitely no.
Absolutely
No,
not.
because there's a science behind root
Right,
canal and it's
exactly.
been done since decades.
Yeah.
Millions of patients have saved their teeth by root canal treatment, and it's a proved text. And we are practice. Of course, not that we. When initially I used to get irritated when patients used to ask me that do root canal cause cancer. I used to answer to them, look, I didn't invent this. I'm only following this. But again, you need a right answer for trying to convince any patient through your podcast. I think. Let this myth be cleared that root canal is a treatment which is done to save your tooth. And tooth, of course, it's a God given gift. Never ever remove your tooth if your tooth has even 10% of its life.
So, 30 years in practice, right? How many root canal cases have you?
I should say around more than 25,000 plus counting.
25,000 root canal.
Yes.
So, what next after root canal? Like, what is a root canal? So if someone comes to you saying that I have tooth pain here, so how do you diagnose that this has to undergo A root canal. This
Yeah.
tooth has to undergo root canal.
Correct. So, see, enamel is the hardest structure in your human body. It's harder than your bone. For enamel to disintegrate, okay, and cause a cavity, you need some external factors to it. Number one external factor is, of course, the diet what any patient consumes. Okay. Now, along with the food, you need a little amount of help even from the saliva, and along with microorganisms, they start burrowing and then causing a cavity. Basically, they start demineralizing the tooth. Well, why we tell every patient, for that matter, to get a checkup every first once in 6 months is when you recognize an early cavity that is already formed, which has gone beyond the primary level of prevention. The first thing that you see is, yes, you see a cavity, it's in first stage, you can definitely go for filling it. Now, if left untreated, now left untreated means, yes, it could be the patient is busy and they're not able to make it, they're not able to get a checkup every 6 months. Yes, the cavity will not wait because eating is a continuous process. So it goes to the next stage. And again, you get busy, you don't have time. Again, the cavity definitely goes to your nerve, what is known as a innervation of the nerve. So once it reaches the nerve, you have either the tooth has to either go for a root canal or a removal, one of them. The choice usually patients has to make. But the right choice always will be a root canal because out of the teeth that when you open your mouth, you see 25% of the teeth in the mouth.
You're saving tooth.
Yes. So the rest, hidden part of the tooth are known as roots, which are 75%. So it takes only 12% of the damage to the tooth, that what you see in the mouth, to go and hit the cavity, to go and hit the nerve. Now, for 12% damage, why do you have to punish the tooth by removing it? You have a tooth which is held firmly by the bone and the gums, which is very strong enough. And that particular thing is something which you have to consider when you do root canal therapies.
Okay. And Smile Dental Care, I've heard, is also the first dental practice that allows pets with their patients. So this is something new.
Yeah. So it happened about 3 years back. A patient of mine, she just asked me, Doc, can I carry my pet with me while you're treating? Well, if something can de-stress, because see, root canal is the most stressful treatment. Watch what I've seen even in some documentaries where patient mention. Because today, see, everybody does root canal. Every dentist
It's a skill.
it's a skill basically. Every dentist can do root canal. But having said that, to minimize the stress on the dental chair, well, I said, why not? I mean, let me be a little open enough where you can carry your pet and then I do my treatment as long as it doesn't disturb me.
So let's talk about fluoride versus hydroxyapatite. A lot of the viewers or audiences, a common man will know what is fluoride because they keep hearing it in chemistry, they hear it, they see it on the toothpaste. This new word, hydroxyapatite.
Yeah.
What is this? What's the difference between the two?
Yeah.
Can you please explain?
See, basically, both help in protecting your tooth enamel as such. Okay. So, when it comes to protection, there's nothing like which one you want for protection. As long as they can protect. If one protects from post-operative sensitivity, the other protects from acid, for that matter. Well, hydroxyapatite is a little safe thing for
It's some
children.
NASA researched.
Yes. So basically, it's little safe for children where, when ingested, when they swallow, they won't have any reaction, unlike fluoride, whatever. But again, as long as protections are good, both can be used as such. Yes, I vouch for both.
Can both be used together?
Oh, yes, it can
They
be.
can be. It's not
Yes.
something
No,
that has
no,
to be
no,
used
no. As long as
separately.
protection, see, at the end of the
And
day.
it's used mainly in a toothpaste.
Yes.
Okay.
So as long as your tooth, gets good amount of protection, whether it is from fluoride or hydroxyapatite, yes, why not? Yes, it can be included. Most important thing is, yes, brushing in the night, which is again very important compared to the morning brushing. So put the kid or anyone who is trying to learn to maintain the oral hygiene to start brushing in the night.
Brush in the night, guys. Dentist is saying brush in the night. All right. So, have you been approached? Now there are huge brands when it comes to oral hygiene. Colgate, Pepsodent. Have you been ever approached by any of these brands to promote their product?
Yeah, every brand for that matter, see, they have their own way of, sending reps and then, incorporating different brands that are coming to the market. Nothing wrong in trying to know what the extra content in their paste is. First, I use it on myself. I find it good. Well, I tell even patients to use them as such. Especially, there's a lot of development that is happening with the desensitizing paste, what were available earlier, and now there's a lot of research on it. And yes, I welcome any good toothpaste which does this job. Yes.
Let's talk about cavities now, right? If someone is visiting a dentist, right, anybody, 9 out of 10 people will say, I have a cavity, it's hurting, right? So, what is this cavity? Like, what happens to your tooth or teeth?
See, mainly first is the simple golden rule of trying to maintain your oral hygiene. Especially brushing your teeth both in the morning and night, the brushing techniques and the toothpaste that you use, and most importantly, what you eat. And I'll incorporate and stress upon this. It's a new thing, or maybe even patients should realize this. Hydration, a good amount of hydration is very important to make flow of saliva good in your mouth. Not many of us know the importance of hydration. Hydration, we just drink water whenever we are thirsty. No, that's wrong. Okay. So how you want your kidneys to function and throw the waste out the same way, toxic waste out the same way, you need good amount of saliva to flow. So I prefer hydration is again very important for any cavities from not forming. So cavities is nothing but the microorganisms which again with the help of acid release for that matter, and along with your carbohydrate that one consumes, which your saliva acts as a buffer and then starts eating your tooth out as such. So the best thing is to prevent it. Prevention is all about how well that you take care of your oral hygiene.
Okay. And can you also talk to us about wisdom tooth, right? A lot of people come complaining saying that my wisdom tooth is erupting, it's hurting a lot. Even me, for example. And it's actually really painful, upper jaw, lower jaw, whatever it is. And there's also this phenomenon where only half of the wisdom tooth is erupted,
Yeah.
pericoronitis,
Yeah.
right?
Yeah.
So, how do you approach this? I know it's something natural and something you cannot control,
Yeah.
and it's a natural phenomena, it's a process.
Yeah. So if the physiological tooth eruption, what we call, the wisdom tooth is a tooth which comes totally last, end of the jaw. So we all take jaw size from one parent and tooth size from another parent. So somewhere down the line, especially this generation, that includes even me, we all have small jaws, large tooth. So there's no space for the last tooth to come out. They always get stuck
So, you have
well
to do a
within the jaw.
surgical procedure to remove it out.
Not all, not all. The one which are symptomatic. See, we always take an X-ray. We see the clinical position of the wisdom tooth, how they are. From my practice, I don't remove all the wisdom tooth. Of course, this is definitely a mandatory thing when teeth, especially the wisdom tooth, any doctor in US or UK or anyone outside the country says, first thing they say is, knock it out. It shouldn't be there in your mouth. Well, from here, from my perspective, I usually think of removing only when it condition becomes acute, only when there is no much eruption space, and it's difficult for the toothbrush to reach that area. Only then we'll think of removing, or I'll recommend removing, not otherwise.
Okay, I feel because of the wisdom tooth is slanting
It could be slanting, it could be, there are different angles.
angles.
Some
Okay.
will be tilted mesially
Uh,
towards the neighboring tooth, the other one will be tilted away from it. Some of them will be sleeping. See, again, how the tooth comes out, it's a physiological eruption, it's not in anybody's hands. The tooth comes out depending on how much of space that is
right.
available in the
Right.
jaws.
Can you tell me about an implant? What is an implant?
Yeah.
I've heard about titanium implants and
Yeah, implant is where when patient doesn't want to undergo root canal, or they would have already got their tooth removed. That is when a hole in the bone is drilled and then an implant placed into the jawbone, and then we allow time of about 4 to 6 weeks, or maybe even some may take even 3 to 6 months. And then when the osseointegration happens, that is when the bone holds together naturally over the implant, then a tooth is placed. It is another method of replacing a lost tooth as such.
A lot of these school going kids think getting braces is cool because of the different colors it has.
Yeah, yeah.
So, what is the psychology behind that?
First thing I always want to tell through your podcast is, well, when it comes to braces, there are two ways of treating and aligning the tooth. One is for the tooth to be straightened. Another is whether the jawbone is slightly moved, whatever. So if it is a jawbone that has to be altered, which can be recognized at the age of around 8, 9, or even 10, that's the time where you correct the jawbone. You allow the upper jaw to
Align with the lower
align
jaw.
with the lower jaw, or the lower jaw to slow its growth to catch up with the upper jaw. That has to be recognized very early. Okay, these are called skeletal defects. Now, next is the dental defect, where tooth alignment. That I always feel, for a dental defect, you wait for the last milk tooth to fall when all the permanent teeth erupts. That's when the braces has to be started. Again, like, although I'm a cosmetic dentistry, smile design dentist, I always recommend braces only when you see malalignment. Like you said, I get patients who say my next door neighbor has one, please put on me, or my cousin has braces in her mouth, or friend's daughter has. No, that's a wrong way of trying to do this cosmetic treatment. Do braces only when it's required. Wait for the normal last physiological eruption of tooth to happen. Once they come out on their own, where and when, if it is really required to make a cosmetic change, only then do braces. Otherwise, I feel God given gift, the regular alignment into the jawbone, which happens naturally. Follow that.
So, what do you have to tell certain BDS graduates or people who want to get into dental? Some advice.
See, basically, getting into dentistry, it's a wonderful career for anyone as such. Maybe even if you see in the last NEET exam, all the dental seats are full.
Do you think it's that exam is making it harder for people to actually pass the bar in order to get into dentistry or other healthcare professional courses?
Yes, see, basically, you can't have a physics paper, which are full of mathematics problem to solve, and then finally say, okay, you get a seat in healthcare or whatever. So you have students trying for medical, some try for dental, some try for Ayurveda, and even homeopathy, physiotherapy for that matter, from this year onwards. So I think I still feel the government should set up a life science paper, which includes botany, it could be zoology, it could be even chemistry. Put more of general knowledge, and then include even human body. Make a separate text for that. Don't include physics, or in which you have problem sorting out with mathematics, and say get this sum right to get a seat into one of the medicals or dentals. No, that's a wrong way as such. See where when CET can remove biology out of its syllabus of trying to qualify for an engineering seat, then why not medical or dental or any other life science subjects?
Okay. Would you recommend anybody who doesn't have a background or doesn't have any kind of a godfather to get into dentistry today, to pursue BDS today?
Definitely. When I can do it, so can anyone. See, I never had any background. My father was not a doctor, or he never had any clinic. But at the end of the day, there's a very good scope if one can finish their undergraduation, finish their post graduation. The world is definitely it's a safer place where he can get accommodated anywhere. Especially, see, our rural areas are lacking with doctors. They can go to any place, and the awareness is quite big with today's social media.
Right.
Small towns or rural areas, or even Bangalore for that matter. So, I mean, there's a lot of work left for everyone. The next generation definitely keeps taking over, and when it comes to healthcare and then serving people.
A lot of people get stuck. What after BDS? Should I do MDS or should I work? And even if I work, I'm getting peanuts.
Yeah.
Yeah. Can you explain that?
See, basically, after undergraduation. Everybody wants to get into post-graduation, but there are limited seats. Now, a few of them show the interest in working for some other doctor. And the government doesn't have any options of government jobs as far as India is concerned. Even if there are any jobs in primary care centers, there are very few as such. So yes, it was a trend in 70s and 80s and even early 90s. As soon as you finish your undergraduation, you can start your practice. Even when I came to Bangalore in 97, the leading practitioners in Bangalore were all undergraduates as such. Because dentistry teaches everyone to get into hands-on work, and you are trained. If your college gives you good cases where you are trained to do any work, undergraduate doctor definitely thrives, and they're doing quite well even Bangalore elsewhere as such. But you post graduation is a must and should. But again, with post graduation, until unless you have the skill to again open your own practice and start practicing the same, along with teaching, which again has closed all the doors on postgraduate teachers. So future will be all about trying to get into mode of opening hospitals, or four or five of them get together, start a practice, and then improve their specialty. But the scope is always there for dentistry as
Is it
such.
viable for a BDS graduate to open up his own clinic without doing masters?
Definitely, as far as if at all there's a, like I said,
If he's well trained
initially, yes, yes. So if one gets well trained to do a job
and he has enough capital.
and enough capital to start one, and good enough to speak and then know what they're speaking and diagnose and treat patients, why not?
And MDS has a lot of branches, is what I've heard. Like, I don't know, 6, 7. How
Yeah,
many?
there are about 9 branches.
9 branches.
9 branches, yes. So you have a root canal specialist, as a gum specialist, you have a pediatric dentist, then you have an orthodontist who does braces, then you have a oral medicine doctor who diagnoses all the oral lesions in the mouth.
Maxillofacial surgeon.
Maxillofacial surgeon, yes, to remove wisdom tooth and then treat fractures. Then you have a community dentist who takes care of, conducting all the camps and then taking a large community into consideration while treating and interacting with students as such. Then you also have a denture specialist called prosthodontics. So there are different branches. But of course, see, basically when it comes to India, it is slowly picking up where patients do recognize to which specialty they need to go to. So they don't know that root canal is done only through an endodontist or a root canal specialist.
Yeah.
They think a dentist does all the jobs fairly enough. If somebody is experienced to do their job, even they can do. But it takes some time. It took me some time. It took me at least minimum 10 years for my patient to recognize, yes, I'm only a root canal specialist. But even today, I get patients, they see me only as a dentist who do all the jobs. That's one reason why I have not kept any undergraduate doctors working for me, because once you attain the name, when patients come to you, they ask for you. Even though my other doctor, my junior doctor.
Exactly, because you're providing a service. You are in a service-based business. So,
Yes.
of course, apart from Smile Dental Care, they look for Dr. Manu.
Yes.
Would you want Smile Dental Care to be bigger than Dr. Manu? Or
Yeah.
do you want Dr. Manu to be bigger than Smile
No,
Dental
again,
Care?
see what happens when they come asking for me. So when my junior doctors, they first see and then still they ask for me, they wait for me. So no point me having a junior doctor who first sees, because when it comes to your mouth, your eyes and your ears, believe me, nobody wants an unexperienced, unknown doctors who to come touch this, their mouth, or they don't want to give their eyes or ears as such. So they want a specialist who is well versed with number of years of experience. And of course, during my time when I started my practice, there was no any social medias. Today you have Just Dials or Practos who keep promoting young doctors who just enter the field, depending on the amount that you pay, the pages are grown or whatever. So I come from an era where we couldn't advertise, it was definitely illegal. It is illegal even today for that matter. So it's the practice of any doctor,
Your
including a
growth-
dentist, is always word of mouth.
So, your growth up until now, 30 years,
Yes.
is purely organic.
Purely word of mouth.
And it's also, and you have so many celebrities coming
Yeah.
to you,
Yeah.
you know.
Yeah.
And
No, don't say celebrities. I cut you there because every patient I see them as a celebrity. And if somebody is coming to me, it's because they've been recommended to go to me. So if you say celebrities, yes, for me, every case is like a celebrity. And I spend my time talking to them, trying to understand what exactly their previous dental history is, trying to know any earlier, x-rays or any, even most of them, even who come to me for a re-root canal or maybe unsatisfied work from other doctors, best is to go ahead and do the work, what you're supposed to do ahead, that rather than getting into the history of where they went, why they went, and all that. So it's all about the future, that you need to again send the patient out of your clinic with a big smile, which is a challenge.
right, you're Bangalore's best endodontist. I want to take this one name
Yeah.
of a celebrity
Yeah.
who you've treated.
Yeah.
Tell me, how was it? What was your experience treating Puneeth Rajkumar? How did he approach you? How was the process like?
Yeah. So
Because he
it
is the
was,
face of Karnataka,
yes.
right?
Yeah.
And people look at him as God, and you've literally been so close to him up front. So talk to me about that.
No, we stay in the same area. So it was through a common friend that he approached me, to perform a couple of root canals. This was almost, I can say, a decade back, 10 years back as such. He's got a couple of work done from me as such. And yes, he did go to even Mysore where, with some pain as such during the treatment. And I had to even recommend a friend of mine in Mysore to see him on an emergency basis. Yeah, I mean, it was an experience for that matter as such.
How did it feel for you? Because you've loved watching his father Rajkumar,
Yeah,
like
yeah.
literally every song.
Yeah, I'm a big fan of,
Big fan,
yes,
Dr.
I'm a big
Rajkumar,
fan, yes.
right? And then
Yeah.
his son suddenly comes up to you saying that, Doctor, hal nauta ide. How, like, didn't you have that thrill or goosebump? Shit, man.
Yeah.
Didn't you feel that? What did you
Yeah,
feel?
initially, yes. I mean, see, again, what happens when it is your work,
I know
when
he's just
someone,
another patient when you're treating him,
no,
but
it's not that. A celebrity is always a celebrity as such, At the end of the day, you have to be extra careful when you treat them as such. And again, when the word of mouth from him goes, which actually went, and he sent two or three of other colleagues of his to come and get treated as such. For me, it was definitely an honor, I should say, in treating him as such.
now you have for the most part single-handedly taken care of Smile Dental Care on your own without any duty doctor, right? Every single day. Don't you find it monotonous?
Yeah,
Isn't it too hectic sometimes?
yeah, I started feeling it in the year 2012. That is when
2012.
2012 I started feeling, this was almost about 13 years back. You are right. For any doctor, it becomes always a mechanical work as such. And 2012, I had to quit even my teaching also. So somewhere down the line, that's when I got into the ultimate form of workout, which is running as such, and that has given me peace till date as such. And I enjoy my run, and then keep myself busy trying to sign up new events and work out. What's more big as such is.
Because you mentioned running, and before I get into the topic of running, because I know you're a big fitness freak, right? There's this $10,000 grill debate, right, which is happening. Gold tooth, diamond teeth, and uh, is it a dentistry disaster, or if aligned properly, it works well for the
No, I'll
human?
not call it disaster. See, gold is always a most biocompatible material compared to any other metal fillings in the mouth as such. Okay, it is very biocompatible, and age-old tradition to have gold caps is there even today. I did one as recent as a couple of weeks back. Well, see, when it comes to aesthetics, okay, aesthetics is always it's always an individual perception. Some may find gold, which is a better tooth to shine in their mouth than a tooth color cap as such. and a diamond stud on a tooth. What I'm saying here is, see, aesthetics is an individual perception. Now, I have people who have crooked tooth, like someone was mentioning, and they feel that's the new thing as such. And
Crooked tooth.
crooked
Crooked
tooth,
teeth.
crooked teeth rather, yes, crooked teeth. Even one crooked tooth tilted. I even tried convincing the one of my patient, why do you have one crooked tooth? Why not make it straight? He said, no, this is a new thing.
Really?
Yeah,
So they say that's lucky for them.
yeah, I mean, see, basically at the end of the day, like I said, aesthetics is an individual perception. I have even midline gaps between two teeth, which looks a little odd, where they try sticking out the tongue through that. The gap is so much, it looks a little ugly. But when patients say, that is the one which gives them luck, I can't change their luck by doing good work, what I feel good to my eyes, right? Like I said, aesthetics is an individual perception. They can carry on, yes.
Tell me, what is the perfect smile?
Yeah, perfect smile. See, basically, perfect smile is you have a few amount of celebrities like, see what happens, your internet carries certain smiles in their algorithm, okay, of about 10 beautiful smiles. One of them that is chosen is our actress Aishwarya Rai as such. So her smile is taken as the baseline. This is how a smile should be. Now, based on them, always the new set of teeth that any patient should look like, to get a perfect smile
Has
with a,
anybody ever come to you saying that, doctor, uh, I want my entire setup, my teeth
yeah,
setup to
yeah.
be exactly like this person?
Oh, yes, very much.
They have?
Literally,
They've come with a photo?
everyone who undergo braces, they come with the same issue.
They come with a photo.
Yes, they come with photo, they come with pictures. They even say, look, I want my smile to be beautiful as such, and I don't want my gummy smile. This is very common with many patients who ask that. So basically, when they're getting their teeth done, the alignment has to be perfect in such a way, the tilt of the tooth especially, with a little amount of spacing wherever it needs to be given, should be perfect in such a way that the smile should be,
Perfectly
100,
aligned.
100% aligned to what they ask for. Yes.
Right. And can you also tell me about Invisalign? Yeah. I heard it's very expensive and people can't afford it. Is there any
See,
alternative
See,
for
Invisalign, well, if anybody wants Invisalign, the first thing the new generations, the Insta watching kids, they do is, they see one of the ads in one of the Insta posts about Invisalign. The dentist is not involved here. The dentist definitely is not involved here. Now they have their own companies. They come, take the impression, and then give you different modules of Invisalign. But again, I'll not recommend Invisalign for every case. Now, not all cases can be treated with Invisalign. But somewhere down the line, things are not going in the right direction as far as someone who is not a dentist and trying to treat such cases are concerned. It's going for a disaster. So I don't really agree with the kind of work what a non-dentist, someone who is, promoting these products are concerned as such. Well, when it comes to any cosmetic dental, like even an orthodontist promoting Invisalign is concerned, yes, they know what they're doing. The best set of treatment always will be a conventional braces, where and when required, we give Invisalign. Yes.
I know you're going to get a lot of hate for this from a lot of your colleagues, but can you talk to me about the placebo effect
Of
of you and your treatment, and because of your skill, because of your hand?
yeah.
Yeah.
See, placebo effect.
On the patient.
Yeah, placebo effect definitely doesn't work in dentistry as far as any relieving pain is concerned, because somebody comes to you with pain. I can't give them a sugar pill and say your pain will go. It doesn't work. It will never work because the human science doesn't say that. It is like a war, hands down. You have to get in and then work on it. Put the patient again on a good amount of painkillers immediately after your procedure, then it works. Placebo effect doesn't have much effect as far as my root canal specialty is concerned.
What's your narrative about the natural teeth cleansers, right? Like neem and salt and baking soda, because a lot of people who still stay in the village, rural areas, prefer this over an actual toothpaste.
So even today, when I get patients, they keep asking me one question. The elders in the village, even today, they use neem stick, they use mud, they use ash.
Do they actually help?
Oh yes, why not? I mean, if teeth cleansing method, anything can be used. If it all use any abrasive for that matter, it cleanses the teeth. Okay, any abrasive,
And
mud
talk
or
about
ash.
and what about charcoal?
Exactly. So even charcoal, it's a abrasive basically. See, you are scratching a
And all
tooth.
these big companies
Yeah.
are slowly using charcoal
Yeah, this
into
is, see,
toothpaste
again, what
to
happens?
attract the villagers.
True, very
Yeah.
true. So when you had, the toothpaste companies, they didn't want to lag behind. When they knew that, they're losing out on many of them not buying this product because they prefer a neem stick, they prefer a charcoal, they prefer a mud. They thought, why not add the same thing into one ingredient and make a thing? So they started adding lime, salt, you have even charcoal getting added to toothpaste. And then they made it a brand, then they left it. Yes, it's a hit. Basically, any toothpaste for that matter, it's only an adjunct with the brush. It's only the brushing and the technique what matters. Doing it twice a day religiously. That's it.
Right. Can you also tell me one scenario in 30 years of you practicing or being a lead practitioner in your own setup that's actually felt like shit, this has happened?
Yeah.
It's like actually shook you.
Yeah.
Can you tell one experience to the
Yeah.
audience that
So I had this.
was actually very terrifying for you?
It is actually. So what happens, I had this. Parents get a 6-year-old kid
Okay.
to me, with shaking tooth. So the time was around 7:30 in the evening.
It was partially shaking or
No, it was very badly shaking as
upper jaw or
such.
lower jaw?
Lower
Which
jaw, lower
lower
jaw
jaw?
as
Okay.
such, okay? Because you have a lower central incisors. When they come out, they shake the milk tooth be right behind it as such. So first thing I told the parents is get this remote. Don't allow this to be in the mouth. The parents said, okay, next the child has to go to school and the ultimately they said they're going to come the next day evening as such. They're not planned whichever way because again, when it comes to treatment, we can only recommend, but we can't force anyone to get it done, even for the kids. So the worst fear, actually, it came to reality the very next day. Uh, the tooth was not there in the mouth.
When he got up in the morning.
When
So
the
he
when the
didn't
kid
pull it
got
out
up in the
before he
morning,
didn't pull it out before he went to bed
no.
on his
So
own.
this is something which I always tell. Even I used to tell even earlier also. I don't know. Maybe I should have forced the parents. Never leave a shaking tooth in the kid's mouth and make the kid sleep. So when one sleeps, there are good chances of the tooth getting aspirated into the lungs.
Damn.
Because in sleeping position,
Mm.
you will not have a swallowing reflex. So there are good chances that child may ingest the tooth into the.
So what happened?
So then
They went back.
they searched below the pillow everywhere.
No, so they
And they
went.
called me.
Okay.
Literally, they
Uh-huh.
called me and
Uh-huh.
I said immediately, just get some chest X-rays done.
But was
So
the child feeling any kind of discomfort? Nothing. He just got up
no,
normally.
the child was actually coughing. The child was coughing continuously. So immediately, they took the child and took the X-ray. And the worst nightmare, the tooth piece, I mean, rather the shaking tooth, part of the tooth had landed into the chest cavity. Yes. So
No.
that's when I
In the
advised them.
chest.
Yes. It
Okay.
directly goes into the.
What happens next?
Yes, what happens next? It is beyond anybody's control, right? That has to be removed. You can't allow a foreign body into a chest cavity.
Right.
So immediately I referred them to one of the hospitals and then I spoke to one of the doctors and they got a bronchoscopy done and then got it removed. But yes, it was a nightmare basically. See, things which are under your control and goes beyond your control, you're helpless. But scenarios like this happen as such. And I've come across a few HIV patients who usually don't reveal their status because they feel that if they reveal, we refuse to treat. But I am of the opinion that if they reveal, we can take precautions. At the end of the day, see, we are dealing with human beings and we can't send them out without treatment. Now, having said that, if they reveal their status, we can take precautions and then help them out as such. But again, I don't know why that taboo among the society and the people. They usually don't come back when we tell them to get blood test done. Same way, even cases of the initial stages of you basically call it submucous fibrosis. A condition where the mouth is going in for a grade 1 or type 1 cancers as such. We tell the patient to leave the tobacco and then come back. Till now,
Lifestyle changes.
only one patient has come back. The rest 9, they refuse to come back because they don't want to kick the dying habit as such. So these
Yeah,
scenarios,
because you spoke about that now.
yeah.
Mm, any can you tell me something about the people
Yeah.
who come to you, or the patients who come to you regarding smoking or drinking, tobacco, a cool lip, gutka, pan? What's one common thing you notice in all these people?
Yeah, tooth stains as such. Tooth stains are something which, of course, these are visible stains. I can remove them. The invisible one happens in the lungs, which is beyond our control again. But having said that, we tell them, to kick the habit because having gutkas, they totally change the oral, the sponginess inside the oral cavity, and you see the inside the oral vestibule becoming very rigid as such, and they go in directly for cancers. But again, these are some of the abusive things which are very rapid that I have come across, and they're very common as such. Yes.
Right. Can you also talk about this vaccine that had been doing rounds? Not not
You're
not in the
talking about
recent past.
you're talking about Caries vaccine.
Yes.
Okay.
I feel it's not been in the news maybe in the recent past,
Okay.
but maybe a while back, a
Yeah, a
couple of
while
years
back.
back
Yes,
is
yes, yes.
what I've read.
So I remember somewhere in
What
'96.
is it? Caries vaccine.
It's called
What?
Caries vaccine. Yes,
96. Okay, that's
'96.
oh,
I'm
that's a long
talking
time
way
back.
back in
Way back. Okay.
'96.
Yeah.
They wanted to make Caries vaccine as a sixth vaccine.
Okay.
So the invention took place. See, all these vaccines, for that matter, they all start in good, the developed countries, and they're promoted in third world countries as such, as a trial basis. But what happened here when they were initiating the trial and tried on rhesus monkeys? That's what they said in the end, that they started giving issues in the cardiac muscle. But if they can alter its adverse effect and then bring it out into the market, yes, I welcome it, because dental caries is a universal issue, and teeth are not one in number, they're 32 in number as such, and it's a big challenge for anyone to maintain a good oral hygiene. Not that my dentistry will come to standstill or we have nothing against it. Okay, so yes, I'm more welcome to, for them to do progress on wherever they stop their research, and then bring about indigenous caries vaccine into the market. Yes.
Right. From the last 3 to 4 years,
Mm-mm.
there's been a massive AI and tech boom.
Yeah.
Right. And you've been very much aware about it.
Yeah.
And even in the coming years, it's only going to grow.
Yeah.
AI tech,
Yeah.
the big question,
Yeah.
can it replace
Yeah.
dentistry?
No, it can't. Definitely can't. Because I tell you, it will only help in diagnosis and treatment planning. And it may even give the prognosis of a particular treatment. But when it comes to hands on treatment, they said the same thing even about robotics.
Yeah, robotics. Yeah.
Robotics or AI, it's good to talk. That's why we see in many new conferences, everybody picking on the same topic and then going on and on. But it's not practical enough where it can replace. Yeah, yeah. Because it doesn't have a human touch. See, a doctor, why does anyone go to a doctor? Why does anyone like getting treated from maybe even world over? You see, they like getting treated from Indian doctors because they have a human touch
Right.
there. That's lost.
The healing hand.
Yeah, that's lost as such.
Right. Doctor, now because you spoke about humanity and all that, you're a doctor yourself, right? And humanity comes first to you, right? Does it come first?
Yeah, of course.
But you're also an entrepreneur,
Yeah.
right? You also have to take care of the business point of view of your setup, of
True.
your clinic, of your
True.
hospital.
True.
Yeah.
True.
So what comes first?
Yeah.
Now,
Getting your name always comes first.
name is first, right?
Yes, yes.
But with name also comes fame and wealth, and a lot of things follow. But you're also a service provider, a healer. So, how do you balance it?
And we have to balance. I mean, at the end of the day, see, I'm totally 30 years into practice. And, not everyone can afford some treatments which are recommended by me. I try to do my level best to at least fulfill their thing. Or I even refer them to institutions which can work them out, in a considerable way. But yes, again, not only me, a lot of even other doctors, they all face the same issues all over as such. So we need to be a human being first, then a doctor as such. Yeah, I mean, because at the end of the day, we see I can't put a board that I treat only kind of a selection people who can afford or whatever. But at the end of the day, yes, I'm open even today that I see all sorts of patients. And yes, I whatever that's possible even from their side, yes, they get it done. Till now, my success rate has been around, say, around 95% strike rate. Okay, that means to say almost
You've convinced 95% of your
I've
patients.
convinced, yes, almost about 90 to 95% of the patient who come to me, they get some form of treatment or the other and then go. Yeah.
Right? I've heard it from a lot of people, and I've seen it with my own eyes. You're a headstrong, disciplined fitness freak who has completed nearly 50 half marathons. That's not a easy feat to achieve, right? So, what got you into running?
Yes, 2012,
I don't think you were an athlete in school or
I never,
college.
never, never, I never
Yeah.
ran in my school
And
days or
for
college
someone to
days.
suddenly start running,
Yeah.
in their mid 30s or is very random. So, can you please tell me what was that shift in your head? Who got you into running?
Yeah, see, basically what happens, your body is the only place where you live in. Okay. So you take care of it now, it takes care of you later.
Okay.
So that's again very important. Now, again, ours is a very stressful job. Dentistry is a very stressful job because it's definitely hands on and then it takes a toll on your life, literally. Especially, you need a strong back, you need strong hands, and you need strong eyesight. Now, more than anything, as such, strong back is something which is very essential. I see many of my senior colleagues having issues at the age of 40s, not trying to gain fitness as far as long term dentistry is concerned. So they always switch between doing dental practice standing and then sitting as such. So that is when, of course, I've been into fitness, trying to do push ups during my college days and all that. But I wanted it to take it to a different level. Now, yes, I started with walk. Walk became brisk walk. Then one day I was just running and I felt happy about it. So it's almost 14 years into my running. Now I do long distance running. So I enjoy my runs, maybe taken part in most of the events, and I enjoy doing half marathons. Yes, I'm almost near taking part in about 50 half marathons. I'm proud to say that. But it's been a long journey and I'm enjoying this. And yes, not that I didn't try running full marathon. I've done a Mumbai full marathon too.
Wow.
Well,
42 kilometers
42 point, yes.
in
So
Mumbai.
Mumbai,
One of
yes.
it? One of it.
One marathon, one full marathon
Okay.
as such. So, but having said that, something which I enjoy to do more, where I love to do is half marathon because it gives me good amount of space to train and I have my time to train. Somehow for full marathons, I didn't find much time to train. And again, I do it for the joy of it again, because at the end of the day, when you run, you need all the happy hormones like serotonin and endorphins, to kick in and help you as such. So this is something which I enjoy as such doing.
What's your training cycle like? How do you train? At this age, you're 54 now,
Yes, I'm
right?
54 running now.
And every Sunday you run a 10K, like it's a piece of cake for you. It's not a joke. 10 kilometers running is not a joke
Yeah, 10 to 15.
at this age.
Yes, 10 to 15 I can actually do without any much
And
train or
you said
whatever.
you still want to keep going.
Yeah.
So that shows the determination and dedication you have. I don't know. That's
No,
immense.
somewhere down the line, yes, for my, to maintain a good balance of, your professional life and your fitness life. Yes, discipline is something which is very important. Now, I started taking part in events mainly because that puts in discipline to you. You have a time where the event or the run starts, and they give you a time within which you'll have to finish.
Right.
So that's something which I enjoy doing it, and that same discipline has actually given me even to my profession, where I somehow maintain my time with the patient as such. Maximum waiting period is about 5 minutes to my patients, because yes, I do go and wait for other doctors when I go for my self consultation. But I know how hard it is when you have to wait for hours together to see a doctor. Somewhere down the line, I feel I've incorporated to my level best. That to maintain that particular time when I give it particular time.
Which doctor do you visit when you have a dental issue?
Oh, there are colleagues of mine who take care of it as such. Yes, and I should mention to this, I have my school friend who got into running, and he got me also into running
What's
as
his
such.
name?
His name is Mitresh.
So he's the one who got you into
He
running.
is the one who got me into running. In fact, he even did a Kardungla challenge in Ladakh. So he asked me whether I could accompany him. I was very happy to do that.
You ran the Ladakh Marathon?
No, I did a half marathon there.
Half marathon in
Half
Ladakh?
marathon in Ladakh. So it was a
That's
high altitude running.
yeah. How did you do that?
No, it's all about acclimatization. So once
Okay.
you get in there as such, get acclimatized, because air has only 50% oxygen.
Yeah, SPO2. Yeah.
Yeah, so you go there and get acclimatized. Once you are done, then it is just like now running anywhere.
Did you during the course of your run,
Yeah.
21 kilometers,
Yeah.
did you ever feel, lost for air, or did you feel like shit, I'm not able to breathe?
Not exactly. It never happened to me in Ladakh, mainly because our acclimatization period was about 10 days.
Okay, so you went 10 days prior to the
10
start of
days
the
prior to the event as such. And then, once you get used to that
there are a lot
particular,
of people
yeah,
who go to Ladakh to ride the bike.
yeah,
You know,
yeah,
Leh and then
yes,
Ladakh
yeah,
and
yeah,
all those places
yeah, yeah,
on that Himalayan
yes,
bike.
yes.
You've gone and ran over there.
Yeah.
What was in your head before you did this? Like you knew
Well,
what?
like when you said biking, 2018, I
Yeah.
went biking
Yeah,
actually
yeah.
in
That's
Ladakh
that's
as
absolutely
such.
normal.
So what happened in a Hunter Valley, in one of the guest houses where we stayed, I saw a medal. And when I spoke to the owner, he said, it's my daughter who has ran a half marathon and this is the medal. That's when I decided I'm going to come back and do a Ladakh half marathon. I
This was
wanted to
back
do
in
that.
2018.
18.
From 2018, this was in your head.
It was there in my head. I started running from 2012.
Hmm.
So 2018, it came to my head. Now I wanted to do in 2020. I was almost nearing registration, but this COVID thing happened. And 2024, that was a time where I could successfully register, go there, stay for 10 days, get acclimatized, and then finish a half marathon. Yes.
But when you run so much, don't you think there's a lot of muscle loss at this age you're experiencing?
Yes, it does happen, because I have maybe another two. My muscle growth may happen, or it may cease any movement as such. So for that, the best thing is to do good strength training. So you need to have good amount of strength training exercises. So I keep shifting with planks, push-ups, pull-ups, and then try to strengthen with leg
Planks or
exercises.
push-ups?
Sorry,
Planks or push-ups?
between both.
Yeah.
I vouch for push-ups.
Push-ups or pull-ups?
Pull-ups.
Why?
Yes, pull-ups. Pull-ups is very tough as such,
Yeah.
compared to push-ups.
If you
Yes.
can't lift your own body
Yeah,
weight,
pull-ups.
yeah.
Pull-ups is something which is ultimate. Now, next you ask me, pull-ups or running?
Pull-ups or running?
It is running, definitely. I'll give running the ultimate form of exercise, because it strengthens and then it activates your 210 muscles in your body with your continuous heart saying, don't stop, go on, go on.
50 half marathons.
Yeah.
Knees good, doc?
Yeah.
Knees good?
So far, good. Yes, I've had injuries,
Yeah.
and I somehow use some natural ailments, do strength training, and I've recovered. Touch wood, where's wood? There's no wood here.
You're a tiger, fighter. That's immense. Insane respect to whatever you're doing.
Yeah. So I'm trying to just balance and enjoy my run. Maybe if you see most of my marathon pics, They're all with a good smiling face. Yes. The day I lose the smile, I stop running. Hope not.
Okay, Dr. Manu, it's time for a quick rapid fire right now. Are you prepared?
Bring it
Right?
on.
Looks maxing cosmetic trendsetter objects, right? Nonsense or science?
It is a nonsense.
One sugary treat that you do not want to consume, that you have to forego. What is it?
You go to any medical shops, first 3 rows is all full of sticky chocolates. Your actual medicine is inside. Yes.
So avoid sticky chocolates.
Avoid in the sense, yes, balance it out.
Charcoal, neem, oil pulling, salt, right? Is it beneficial or not?
Charcoal is bad. Yeah.
Because it's an abrasive.
Yeah, it's a very bad abrasive.
If there's one dental billboard that you have to put in Bangalore or Bengaluru and say something to the world, what is it?
Your teeth are like Mercedes Benz. Don't get it for first service after running 5 lakh kilometers.
I have another fun round for you. It's a myth busting round, right? I'll give you a statement. You tell us if it's a myth or a fact. Mouthwash can replace brushing.
Myth.
Flossing isn't necessary.
Myth.
Electric toothbrushes are better.
Myth.
Whitening damages teeth permanently.
Not exactly as such. Whitening, also known as bleaching, where it oxidizes the organic pigmentation of the teeth.
Myth or a fact?
You want in one word.
Yeah.
Whitening damages. Well, if it is overdone, yes, why not? So we all know what happened to Michael Jackson, So basically, you want your teeth to be white and more white. What happened with Michael Jackson, right? So he
Overdose.
Anything with overdose always is a catastrophe in waiting.
Bad breath comes from the stomach.
Yes, very much. So true. Yeah, very fact. Yeah.
All right, Dr. Manu, we have come to the fag end of this show. If you have to give one advice to your patient or patients or viewers, what would it be?
Definitely. See, basically, one has to take care of their good oral health, and one has to take good care of their general health, which is very important. Hydrate, hydrate, hydrate. That is one thing which I always want to specify and then stress on it. This hydration is again very good. Brushing your teeth in the night is again utmost important thing, which most of you fail to do, or even if they start, they end in a very quick time. So see to it that you take care of all this.
If you have to go back to your younger days or younger self, what was one thing that you would want to change in Smile Dental Care?
It took me some time to get that branding. Okay. So, during my time, there was hardly any internet or any podcasts, or we couldn't have approached for advertising thing, because we purely believed in, yes, it is the patients who are the ones who going to give a word of mouth, because that was a thing then as such. But yes, uh, by all these podcasts and medias, yes, this is what I miss. Through podcasts, you can actually reach out to larger people as such, and the awareness also can be made the very quick way, especially for this Gen Z, because this is something which they most of them see this as a reel, and then they incorporate it immediately, rather than trying to read facts from any books or texts.
This is it. Thank you so much
It's
for
a
being
pleasure.
on this show. Thank you so much for taking the time out
Yeah.
and having this conversation
Yeah,
with
it's a
me.
pleasure. It's a
It's gonna
pleasure,
help-
Anshul, for you having me here as such. Yes.
Yeah. Thank you so
Wonderful.
much, Dr. Manu.
Wonderful.
Thank you so
Yeah.
much.